Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free training classes on clinical hypnosis with several free ebooks. Assess the benefits of quitting smoking. Clarify what is most important to you. To know if you really want to quit smoking, we propose a very simple exercise. Make 2 lists of reasons in the lists of reasons why you smoke. Write down all the immediate compensations that smoking gives you. If the reasons for quitting, you want to quit smoking, write down all the immediate compensations that smoking gives you. If the reasons for quitting are less important than the reasons why you smoke, you will need to reflect to find your own reasons for quitting. But don't get discouraged. Keep thinking about them. Go back to the beginning. Advantages of quitting smoking. Let's look at the most frequent advantages pointed out by the majority of people who have already quit smoking. For health reasons, to breathe better, to get less tired and to stop coughing, to live longer and live better, to reduce my chances of having a heart attack, to respect the right to health of the people I live with, especially children, elderly, or people with health problems. And in pregnant women, to increase the chance of having a healthy baby, to decrease complications during pregnancy and childbirth. Complications during pregnancy and childbirth. To avoid serious health risks to my future child. To improve your quality of life. To regain good breath and not chase anyone away from my side, so that my clothes do not stink of tobacco. To enjoy a fresher and cleaner environment in my house. For my kisses not to taste like a stale ashtray. To not burn any more shirts or trousers. To regain a clean white set of teeth. To spend money on more rewarding things: music, perfumes, books, cinema, theater, games, travel, holidays, etc. To not have to paint the house every year. To save on dry cleaning. For self-esteem and concern for their own. To free myself from this horrible slavery, because I'm worth too much to let myself be crushed by tobacco. To avoid aging. To prevent the premature aging of my skin. To make my face look as old as I really am. To give joy to my partner. To be a good example for my children. I hope they never have to go through this. Aside from listening to those who have already quit smoking, you should also know from the thousands of epidemiological studies conducted over the past 50 years. The available research indicates that all people can quit smoking, and that, in some life circumstances, this is a change that cannot wait any longer. A prerequisite for moving forward. Don't procrastinate. You have much to gain. Harms of smoking. Smoking claims one life every 8 seconds. More than 40 components of tobacco smoke are carcinogenic. In developed countries, tobacco-related cardiovascular diseases kill more than 600,000 people every year. Tobacco consumption affects from head to toe, hair loss and the appearance of mouth sores, cataracts, 40% more frequent in smokers. Smoking causes and aggravates several eye conditions. Wrinkles, premature aging of the skin, making it dry, rough, and furrowed by tiny wrinkles. Hearing loss, middle ear infections 3 times more often can lead to other complications, such as meningitis and facial paralysis. Skin cancer doubles the risk of skin cancer. Squamous cell carcinoma of the skin. Deterioration of teeth. Excessive tartar, yellow teeth, and deterioration of the mouth. Emphysema. In addition to lung cancer, smoking causes emphysema and reduces lung capacity and may require a tracheotomy to breathe. Osteoporosis. Bones lose density, fracture more easily, and take up to 80% longer to weld. Gastric ulcer. Ulcers respond worse to treatment. Berger's disease causes gangrene and necessitates amputation of affected area. Finger dyschromia. Tar-containing smoke stains, fingers and nails a yellowish brown color. Uterine cancer and miscarriage. Increased risk of cervical cancer and uterine cancer with infertility problems. The risk of lung cancer is 22 times higher in smokers. Rhythm tests. If you want to know yourself even better, you can take the following tests. It will allow you to know if you still need a bigger push to quit smoking. Then we'll go on to study the facts and myths about smoking cessation programs, which will help you to dispel unfounded fears about the consequences of quitting. If you're interested in learning more about clinical hypnosis, watch our next video, Myth and Truth about Smoking. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis, with several ebooks also free. If you have questions, add them in the comments area. On this topic and many others, we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.